I'm Ed Pruitt, Editorial Director for NEJM Catalyst, and I'm very pleased to be here with Mark Radford, PhD, RN. Mark is Chief Nurse for Health Education England and Deputy Chief Nursing Officer for all of England. And Mark, I know it's a very busy time for you, so I appreciate you taking a few minutes here to talk about vaccine distribution. And let me just open by asking you to describe the current situation with vaccinations in England.
Thanks, Ed. It's great to talk to you and also your online readership, really, and to describe the situation here in England in relation to vaccines. So I think some of your listeners will have heard, obviously, that last week we started our vaccination programme here in England using one of the first range of vaccines coming out of Pfizer-BioNTech within our National Health Service, and started in Coventry. Which is a town not too far from here in the middle of England, but it formulated part of a network of hospitals up and down the country that started as our hospital hubs, vaccinating not only those most at risk and vulnerable in our communities, greater than 80 years of age, but also our frontline workers. And this week we started to use our general practitioners and our networks of nurses and practitioners out in community settings to start to vaccinate more vulnerable people in local communities. And as and when we get vaccine supplies start to come through and different vaccines, we're starting to look about wider, more population-based vaccination centres, again, led and delivered by the National Health Service.
Very good. So you mentioned healthcare workers and older people. Run us through the order in which people are receiving vaccines. I know the very first vaccine in the world was distributed in Coventry to an older woman.
That's correct, Ed. So, Margaret Keenan in Coventry, a 92-year-old lady, was vaccinated with the first vaccine. And interestingly, obviously, Coventry is quite close to Warwickshire. The second patient was actually a gentleman called William Shakespeare. But it is a part of a wider programme. We have here in the United Kingdom something called the JCVI, which is an organisation at governmental level of some of our scientists, a large group of people that have made a lot of detailed analysis of the evidence base about the appropriate way that we need to distribute the vaccine, particularly in the early stages as vaccine availability is partly limited by production. And they have been very clear in terms of the guidance to healthcare professionals and leaders within the National Health Service about protecting those most at risk, so based upon age and underlying health conditions. But also the second tier of people, particularly those who are in our care homes. And importantly, in the second group is our healthcare workers. And so we've been set out a programme to make sure that we're able to vaccinate in the early phases those who are very vulnerable clinically, as well as those who are very old, but also importantly, those who are in care home facilities and our frontline workers. And over the next few months, what we will do is increasing numbers of people will be vaccinated based upon the JCVI guidance.
I see. And what is the timeline for the rollout given the expected supply?
Yeah, it's a really good point, Ed. So we're obviously, like many nations across the world, we are working with a number of different suppliers around vaccines, and they are coming online at different times. So we are adjusting our programme based upon vaccine supply, importantly against the JCVI guidance. But this is going to be a marathon, not a sprint. So we are particularly focused on making sure that we can give sustained levels of citizen level vaccination through the next few months. But I would expect the bulk of the vaccination programme to be largely completed towards the kind of March, April, May period into next year.
Mm-hmm. So indeed a marathon. When will you personally receive the vaccine? When do you expect that?
It's a good question. I'm a registered nurse, and whilst I'm in a leadership position nationally in support of the vaccine programme and education and training for the National Health Service, my colleagues in frontline clinical practice need the vaccinations first, so they'll be offered it. I don't have any underlying health conditions, and I'm in my late 40s, so I'll be one of the further tranches of people who are getting through one of the citizens vaccination programmes in support of that.
Very good. Is there any suspicion of the vaccine or resistance to receiving it in England as you see in parts of the United States?
Yes, Ed. I mean, it's one of the real challenges, I think, as healthcare professionals we have in making sure that we provide the right information to people to make informed decisions about the access to the vaccine. And I think, you know, as we've seen globally, many people have suspicions of vaccines and their safety. But we know in terms of their production, we know about the scientific advice and also the kind of governmental support in relation to both funding and also the regulatory approach, that we've got a safe and effective group of vaccines in place. So we need to use that information to make sure our citizens are really clear on the safety and efficacy of this vaccine. But we still have to combat a lot of misinformation about conspiracy theories associated with vaccination programs, and also, you know, individual concerns about in the products within the vaccines themselves, and also wider potential views of people that this is part of a wider challenge to society. But I think, you know, we're seeing quite good uptake rates in terms of our surveys of people wishing to take, but there are populations and groups where this is less so. So we've got more work to do in communicating that.
Mm-hmm. So that's very interesting. I want to follow up on that. What are the means by which you can combat misinformation? So social media, public announcements, what else?
I think all of it. There's not one single thing that I would say is going to be mission critical. I think we have to tap into local communities in particular. So we know that faith groups and other social leaders in communities have a really strong role in convincing people that vaccines are safe and effective. Healthcare workers themselves, particularly family doctors and family nurse practitioners and nurses, have a real key role. But also in terms of wider government messaging and also reinforcing issues such as safety and efficacy are going to be really quite critical. So I think there's a multitude of channels we need to use, including social media, print. I think we've also seen a lot of high profile individuals stepping forward to get their vaccine early. And I think these are really important strategies to get uptake as high as we can.
Mark, are there bottlenecks or hurdles in distribution of the vaccines that you foresee that the nursing workforce, the healthcare workforce will have to overcome?
It's been a real huge challenge, and not just a clinical one. There's the logistics, there's the supply networks. Obviously, your listeners will know that the early vaccine, the Pfizer-BioNTech one we're using, needs to be stored at ultra-low temperatures in terms of -70 degrees. So there's logistics around supply chain, and also the distribution to some of our hospital networks that have the appropriate licensing arrangements and also cold storage available, and getting those out to different parts of our community. But of course, we await other vaccines that come on board, including the Oxford one potentially later this year, which can be stored importantly at slightly higher temperatures than in normal fridge conditions, which allows a different distribution model out into that. So there's been lots of challenges around a new technology in terms of vaccine. There's training and education requirements that we've had to put in a lot to make sure that our healthcare workers are up to speed in terms of the management of this vaccine, but also its distribution to patients, so they've got the right information to make decisions. But of course, we're doing a different model. So we're going to be using large vaccination centres as well as distribution through family doctor networks. So we've had to do a number of things in terms of preparation of our workforce for them to be able to feel ready and comfortable in terms of managing a programme of this scale.
And at Health Education England, you must be tasked with that. Big part of your role. How have nurses in general fared during the pandemic, and what is their mood now that the vaccine has finally arrived?
I think like nurses globally, and I connect with many nurses even across the United States and across the world. I think nurses have been really right at the front of the pandemic alongside other healthcare professionals. Sadly, we've seen large numbers of healthcare workers die as a result of being exposed to COVID-19, which is deeply sad, but it kind of highlights the nature of the professional workforce that we have within our healthcare systems. But I can't say that you know, our nurses have done quite an amazing job in terms of looking after our hospitals, our community settings, our general practice environments, looking after their patients and their communities. But I know that we have got a sight of some concerns already emerging in terms of the mental health and the stress and the burnout of our nurses. Whilst they're working extremely hard at the moment, we are going to need to be focused both here in England and also internationally on the mental health of our workforce, the resilience, and also importantly, the support they're going to need, not just now, but also in the future.
It's something we've heard about all over the world, as you say. So just to close here, I did see that Health Education England has reported that applicants to become nurses have gone up sharply in recent months. What do you attribute that to?
Yeah, thanks, Ed. I mean, we're very, very pleased. Our role is to develop training and education and improve the supply of nurses to the National Health Service. And we've been working with NHS England, the organisation that runs our hospitals and services and clinics, as well as also our government, to put in new packages and different approaches to increase the number of places available at university and support financially and educationally for our nurses. We planned that last year prior to the pandemic, but what has been interesting is that during the early wave of the pandemic, the interest in nursing and healthcare careers really increased quite a lot. And some of that will have absolutely have been as a result of people seeing the media portrayals of our healthcare workers managing the pandemic itself. So with the package of support we've put into place to support expansion with the government and NHS England, alongside the wider benefits that people have seen of being a nurse in healthcare, I think has seen a 26% increase in the number of applicants this year into our nursing programs, our degree nursing programs at universities across England, which is a phenomenal step forward, because we need to produce high quality graduates for our healthcare system. But also, of course, we need to retain the ones that we have, hence why our focus also about retention strategies are going to be equally as important to the nurses we have already.
Excellent. Well, that's an extraordinary increase. So Mark, thanks very much for taking this time. I'll let you get back to work, but it's been a pleasure speaking.